Is honey really the healthy superfood it's cracked up to be? Or could it actually be doing more harm than good for some people? Hey everyone, welcome back to the channel. Today, we're diving deep into one of the most debated topics when it comes to natural sweeteners, honey. I know what you're thinking, wait, honey is natural, packed with nutrients, and it's been used as medicine for centuries. How could it possibly be bad? Well, here's the truth. Honey isn't for everyone. In fact, if you have certain medical conditions or concerns, honey could actually be making things worse. Whether you love it in your tea, spread on toast, or use it as a natural remedy, you need to know these risks before you reach for that next spoonful. Let's get into it. First and foremost, let's begin with a big one that every new parent should be aware of. Never give honey to a baby under 12 months of age. And I mean never. Why? Honey can contain spores from a bacterium called Clostridium botulinum. While these spores are harmless to adults and older kids, they can cause a serious illness called infant botulism in babies. Infant botulism is rare but can be life-threatening. It affects the nervous system and can cause symptoms like muscle weakness, poor feeding, constipation, and even trouble breathing. Babies' digestive systems aren't fully developed yet, and they don't have the gut bacteria needed to fend off these harmful spores. That means even a small amount of honey could lead to a dangerous situation. And don't just think about raw honey. Sometimes honey sneaks its way into processed foods, too, so always check the labels. So, rule number 1. No honey for babies under 12 months. It's just not worth the risk. Next up, we have people who suffer from diabetes. I know, honey is natural, and it might seem like a better alternative to refined sugar, right? But here's the thing. Honey still contains a lot of sugar. It's mostly made up of glucose and fructose, which can cause your blood sugar levels to spike. For people with diabetes, managing blood sugar is crucial. And while honey does have a lower glycemic index than table sugar, meaning it causes a slower rise in blood sugar, it can still lead to blood sugar spikes if consumed in large amounts. It's a common misconception that because honey is natural, it's totally safe for diabetics. But at the end of the day, honey is still a carbohydrate, and for those with diabetes, carbs need to be carefully monitored. Even though it's packed with some nutrients, the risk of hyperglycemia, that's when your blood sugar gets too high, makes honey something to eat in very small, controlled amounts, if at all. If you have diabetes, always talk to your doctor or dietitian before adding honey to your meal plan. Now, let's talk about something that a lot of people don't realize: allergic reactions to honey. Honey can actually cause allergic reactions in some individuals, especially if you have a pollen allergy. Since bees collect pollen to make honey, small amounts of it can end up in the final product. For people who are allergic to pollen, eating honey can trigger itching, swelling, and even more serious symptoms like shortness of breath or, in extreme cases, anaphylaxis. This is especially common with raw honey, as it's less processed and contains more of the original pollen. But even pasteurized honey can still cause reactions if you're particularly sensitive. So, if you know you have pollen allergies, bee sting allergies, or you've had allergic reactions to other bee products, you might want to steer clear of honey or at least check with a healthcare provider first. Allergic reactions to honey might not be common, but they can be severe when they happen, so take it seriously if you have a history of allergies. If you find this video helpful and informative, please support the Healthy Pantry channel by leaving your comment below, liking this video, and subscribing for more daily health and nutrition tips. Here's a question. Do you suffer from digestive issues? If the answer is yes, especially if you have something like irritable bowel syndrome, IBS, or fructose intolerance, then honey might not be your friend. Honey is rich in fructose, and people with fructose malabsorption, or IBS, often find it hard to digest. What happens is that the fructose isn't fully absorbed in the small intestine, so it travels down into the large intestine where it gets fermented by bacteria. This can cause uncomfortable symptoms like bloating, gas, diarrhea, and stomach cramps, basically making your IBS symptoms a whole lot worse. So if you notice that you feel uncomfortable after eating honey or any other foods high in fructose, you might want to cut back and see if that helps. Honey may be natural, but for people with certain digestive disorders, it can definitely be a trigger. Moreover, for people with weakened immune systems, such as those undergoing chemotherapy or individuals who've had organ transplants, honey, especially raw honey, can be a bit risky. Raw honey, unlike the pasteurized variety, hasn't gone through the heating process that kills off bacteria and spores. Normally, your immune system can handle these microbes without a problem. But for those with weakened immune defenses, raw honey could lead to serious infections. This includes not just bacteria like Clostridium botulinum, the same one I mentioned earlier in relation to babies, but also other harmful microbes that can cause foodborne illnesses. In cases where your immune system is compromised, it's best to avoid raw honey and stick with pasteurized options, or better yet, talk to your doctor to see if honey is safe for you at all. No one wants to deal with an infection on top of an already weakened immune system, right? Now let's talk about people with heart disease or those who are trying to manage their weight. Here's the deal. Honey, while natural, is still calorie-dense. 1 tablespoon of honey contains around 64 calories, most of which come from sugar. For people who are struggling with obesity or trying to reduce their calorie intake for heart health, consuming a lot of honey can actually work against your goals. It's easy to fall into the trap of thinking, oh, it's natural, so it must be good for me. But even though honey has health benefits, it's still high in sugar, and consuming too much can lead to weight gain, which is one of the risk factors for heart disease. Not only that, but excess sugar intake is linked to higher levels of triglycerides and can increase your risk of high cholesterol. So if you're dealing with heart disease or working to lose weight, it's a good idea to limit how much honey you're adding to your diet. Small amounts are fine, but remember, it's still a form of sugar. Did you know honey actually has a mild effect on lowering blood pressure? While this is good news for people with high blood pressure, it's not so great if you already have low blood pressure, hypotension, or if you're taking medication to control high blood pressure. The compounds in honey can act as natural vasodilators, meaning they help to relax and widen your blood vessels, which leads to a drop in blood pressure. If you already have low blood pressure, this can cause symptoms like dizziness, fainting, and weakness, especially if you're consuming large amounts. If you have low blood pressure or are on medication to manage your blood pressure, it's smart to talk to your doctor about how honey might affect you, just to be on the safe side. Now let's talk about something that might not be as immediately life-threatening but is still important: your dental health. Even though honey has antibacterial properties, at the end of the day, it's still sugar. And like all sugars, it can cause tooth decay, cavities, and enamel erosion if you're not careful. Honey is sticky and can easily get trapped between your teeth, giving bacteria the fuel they need to produce acids that wear down your enamel. If you're consuming honey regularly, especially if you're not brushing or flossing right afterward, you're increasing your risk for dental problems. And trust me, no one wants to deal with cavities or painful dental procedures just because of too much honey. So make sure you're practicing good oral hygiene. Brush, floss, and consider cutting back on how much honey you're consuming if you want to keep your teeth in tip-top shape. So there you have it, folks. While honey can be a delicious and healthy addition to your diet, it's not for everyone. If any of these medical concerns apply to you, it's always a good idea to consult your doctor before consuming honey. It's all about balance, and what works for one person may not work for someone else. If you found this video helpful, make sure to give it a thumbs up, subscribe, and hit the notification bell so you don't miss out on future health tips and advice. Thank you for joining us here at the Healthy Pantry. We hope you found the information valuable and inspiring. Remember, your health is a journey, and we are here to guide you every step of the way. Thank you for watching, and we will see you in the next video.